Can anybody take any more inspiration or strategy? And to all the folks that are still with us in the virtual part of the Aspen Forum on Children and Families, we want to say also thank you for staying in and being part of this. And just on that, sort of going from thanking, obviously Governor Polis and Mayor Bowser, but I really want to give a big love note to the 75 plus and growing network partners, families, parent advisors, fellows and funder friends that are really making that work happen in Colorado and DC, and actually in every other state in this country, and the state to be the District of Columbia, and Puerto Rico, another state. But that this work really does come from community up. And I also really want to recognize, while we don't, the partnerships we have with American Indian, Alaskan Native, Native Hawaiian, and working in partnership, and most importantly, learning from sovereign tribal nations, is also a really important part of who we are of the Ascend Network and family. And so I just wanted to say thank you. So we're going to now move into kind of some conversations really thinking about the power of partnering and leveraging the power of government, and especially health and human services. And we're really lucky to have an extraordinary panel and a panel discussion with some amazing state leaders, and then also hear directly from Assistant Secretary January Contreras. Now, in a moment I will bring her up, but she has been leading both formally and informally with the administration efforts for the safety, the well-being, and the economic stability of children and families, and especially those that are under some of the greatest assault. I've been thinking about how are we keeping families together, safe, and really trying to put our values to work on behalf of the Biden-Harris administration. And so we've talked a little bit about where we are now, where we're going. So just some quick thoughts for you all as you're ready to take this in. 1953, the Department of Health, Education, and Welfare was one of the first governmental agencies created. And in 1979, it split to become the Department of Ed and Health and Human Services, just where we think about, policy structures, how does it go? Actually, a shout out to one of our donors and partners, Isa Cato Shaw, who her grandmother was actually the first cabinet secretary, Ovida Culp Hobby of Health, Education, and Welfare. Her daughter, Isa Cato, now remains in love with all of you and the work you do, and also provides artist and giving. So I just share that because even when we think about relationships on the inside and outside, we've been really trying to think about the power of relationships, Secretary Contreras. And I know you list not only the 1,500 employees that work alongside you at the department, but also you talked about the importance of working alongside with tribal nations, states, local governments, territorial governments, and also the nonprofit leaders and philanthropic partners. And so I think in your heart, you've got that inside outside. Let's think about the heart and the power of health and human services. And so we've been lucky to have Ascend Fellows, Asia Schomburg, presenting earlier, as well as Nikki Hatch, who's one of your regional coordinators, who's doing outstanding work. We like to work county, state, regional, up to the federal, as well as Michael Warren was here earlier for the Maternal Child Health Bureau. But when I think about the federal government, literally the Administration for Children and Families, which you lead as the Assistant Secretary, is the cradle. It is the two-gen cradle. 60 programs and about $62 billion. We'd love to make sure you can work with your team and others to get it to where families need it most, informed by lived experience and expertise, to really ensure intergenerational family prosperity, well-being, and economic flourishing, grounded in equity, becomes the reality as soon as possible. So Secretary Contreras, it's my pleasure to bring you to the podium, and thank you for joining us.
Well, thanks for the opportunity to be here with all of you today and to Ascend for inviting us, and to my colleague, Associate Commissioner Schomburg, who's still here. I'm glad you were able to hear from her. So I'm January Contreras. I have this incredible privilege of serving as the Assistant Secretary for the Administration for Children and Families. Really incredible. And so because I'm in this room, just know that any one of you could someday, much to your own surprise, end up leading on this side of the equation. In whatever equation you're in now, first of all, I thank you for that. And secondly, I completely acknowledge that the work we do at ACF wouldn't reach the people that it's designed to in the authentic ways that it's designed to, in the ways that it's designed to meet the need, wouldn't happen without all of you. So I thank you all for being here and for considering ACF one of your partners, because we certainly do ourselves. As I use my 5 minutes and 45 seconds left, I was asked to touch on a couple of things, and so I want to be able to do that. A little bit about my background. I am from Arizona. All right, Arizona. It has been so fascinating and incredible for me in this role to see how different states, how different jurisdictions build their safety net, invest in people, prioritize their human services network. My background is mostly in state government. I started in Medicaid, was assistant director there, and led the Department of Health Services in Arizona. And then I got this crazy idea that government sometimes moves a little too slow, and I wanted to see a beginning and an end to my work, and I wanted to see it in a person's face sitting right in front of me. I started a legal aid center in Arizona and ran that for 8 years, and we served kids and young adults dealing with some of the worst circumstances. You did not want to be eligible for our services. Kids and young adults dealing with homelessness, abuse, human trafficking, or were in or alum of the foster care system. Changed the entire makeup of my DNA. I've always been a public servant, and I could never claim the lived experience that my clients had, but boy, walking through their journeys as their lawyer sure did give me a different perspective. And it gave me a very different perspective of government services. Right? We're working so hard, and especially if you're in this room or you're watching, I mean, you're part of problem solvers, right? You see challenges. I think what I love about the human services community is we're the ones who see something and can't look away. We choose not to look away, and maybe even if we tried really hard, we still couldn't look away. And that is what we do in human services. And at ACF, I have this incredible privilege to be a part of an amazing leadership team. So wherever you are, whether that's child welfare or our ACYF or child support or our Office of Family Assistance, our refugee resettlement, all of these programs that we have, Head Start, childcare, or early learning, they're just filled with amazing people who are deeply committed to the mission of ACF, which is the well-being of kids and families. And I really do consider that to be just an enormous privilege for all of us to be in that space and to serve where we do with all of you. One of the things I was asked about is to address how ACF is working to break down silos. I'll be the first to say none of us get this 100% right. But I am very proud that this administration, the Biden-Harris administration, the leadership of Secretary Becerra, HHS, has been very, very clear in their charge to us as leaders that we are to work together, that we are to collaborate, that there are problems out there that cannot be solved if we're not sitting in the same room, talking to each other, trying to move each other to actually come up with solutions. And I just want to share a couple of examples because it's not just a value, but just some examples of what's been happening just in the last year. We launched a streamlined eligibility process for folks who are eligible for SNAP to be eligible for Head Start. Okay, is that low-hanging fruit? Yes. Is it so intuitive, and have our policy and advocacy community been recommending it for a long time? Yes. But we made it happen because we got the right people in the room. And that means something. For those of us who have worked with struggling parents, especially in my case, a lot of young parents, you make something too difficult and that's just the barrier. They will not be able to follow through in that application process. They will not be able to take advantage of a service that could make the difference for their child's success. If we don't work with them to make this good government, smart government for them. Another example, it is completely lawful for states to assess child support assessments against parents when their children come into the custody of child welfare. And I don't say that with judgment, but we had our child support director and our child welfare associate commissioner come together. They held some convening. They put out guidance to say, this is lawful. And it's the way so many of us are used to doing business, but it doesn't have to be this way. And in fact, I got a little nervous when I was reading the guidance because it seemed kind of, in the beginning, very gentle. And then you get to the line where it just says, we really recommend that you don't do that anymore. And that's all we can do is provide the guidance. You know, our country is built on states being the laboratories and figuring out what works for them. But by doing that and holding this convening where states who had already made that change, states who hadn't got to ask questions, we've already seen movement of states changing that. And I had the incredible opportunity to be on a phone call with parents, both biological foster care parents, kinship caregivers, and just out of the blue, one of them start to share her story of how she was in the state of Washington, that she was being assessed child support, working very hard to get her child back. And she had just got the news that she was no longer going to be assessed this child support. And on the phone, this was a Zoom call, started, getting teared up and sharing with us her lived experience, which is, you don't know how better this makes me able to do the things I knew I need to do to get my child back. That's the kind of thing when our leadership comes together, even if we can't change a policy or a law, we can provide that guidance and we can create this space where states are talking to one another and learning from one another about different approaches. When it comes to kids in child welfare who sometimes run away, sometimes they're out of placement and the systems are trying to find them and trying to make sure they're safe. Just this last year, we had our Children's Bureau, our Office of Trafficking in Persons, our Runaway and Homeless Youth System, our Administration for Children, Youth, and Families come together to create new guidance, to hold a national briefing with child welfare workers, and really help them have a roadmap about what are some of the best practices and providing new training for them so that they have more at their fingertips to try to keep kids safe where they live. Our Tribal Early Learning Initiative is something where Head Start, child care, and maternal home visiting are working together with our administration on Native Americans and with tribes, because tribes are telling us They want to know how to braid that funding. They want to know how to make those programs work together. And it's a really, really wonderful thing that's happening. Mental health, which is so on the minds of so many people in our country. We at ACF partnered with SAMHSA just a couple weeks ago to hold a parent training on how to support their children's mental health. We had 3,000 people participate in this training. And that's an area where, again, we're together, we're listening to parents tell us they need more help, and we're able to come together to share a resource that can help parents. And I hope something that's on all of our minds, no matter where we are in the ecosystem of human services, is, continuous enrollment for Medicaid is ending. We're right there with CMS. We know that we serve many of the same people. We know that if they lose healthcare, it impacts them in all the other ways that we provide services in. And so just another example, that's an all hands on deck effort that's going on. And I hope all of you are a part of that effort. If you're not yet, please go to CMS, Google CMS and Unwinding. They have some amazing tools. They're designed for people who are working with working class families, low income individuals on a regular basis. They have some real ready-made tools you can use to build it into your daily interactions with people that you serve, so that we can try to avoid the potential for tens of millions of people to lose their health care. Together, we really can make a difference there. So those are just some of the examples of just some of the magic that can happen when we are not territorial, when we are not trying to elbow each other, when we are literally looking and listening to those we serve and saying, this is the problem they identified, and it's harder because it's not only in my shop or only in your shop, but how do we solve it? I also want to address equity. So last February, right before I got to ACF, actually, ACF put out a new strategic plan. How am I think I'm fine. It has a negative, but I'm sure it doesn't mean I'm over. Am I? Oh, I am. Thank you for being honest. Okay. So I will wrap it up. It's because I'm so used to having like a 20-minute slot here. I'm glad that the negative does mean, yeah, you're out of time. And I'm way over then. Okay, so I need to stop. I'll just share with you. Our strategic plans focus on equity, on prevention, on innovation, on that whole family approach. I haven't even got to the 2-gen prosperity part. But just know that those are not just values that we are espousing, but just like the list I just read you, when you look at all of those commitments that we've made as our guiding post, as our North Star for how we are delivering human services, there's a list related to all of those too. So I thank you for what you choose to do. I know this is a calling, and and I look forward to our teams working together in some way to really, be there for people when they need us, and to try to help make sure they don't need us anymore. Thank you.
Secretary Contreras, thank you so much. And we would like to have 20 minutes. We'd love to have an hour. So we will follow up with you for continued conversation to go deeper. And we thank you for your leadership, and also calling out to folks that you might be leading you might be the next secretary. So watch out, as well as the new partner with the agency. You never know. But thank you. All right. Okay, so we are in the last round here, and we are going to just jump right in because we have to about 2:45, and then we have a very, very special close. This session was titled Trust and Transformation Equation. So Nothing from when I used way back in my life. I had the great privilege of working and learning how much I didn't know and how much I needed to learn when I worked for the Council of Energy Resource Tribes as a white woman who grew up in Pittsburgh and moments there. But there's nothing like, hi, I'm with the U.S. government and I'm here to help you. You know, that's just something I'm just sort of playing with this, keeping this real about what does trust mean and look like when we're really trying to work towards a shared North Star of intergenerational family prosperity in a way that is really going from strength. $4 billion, more or less, from a federal influx going down at the states. States are where decisions, budgets really impact real lives. And so we have 4 outstanding leaders who are going to represent some incredible work and their own leadership magic. I am going to go down. Well, first, so we have Commissioner Amy Jacobs. She is with the Georgia Department of Early Care and Learning. They've been a fabulous 2Gen state and partner. We have the amazing Drayton Jackson, who you've heard from as a parent advisor, executive director for the Foundation for Homeless and Poverty Management, and is also co-chair of the steering committee of the Poverty Reduction Work Group that's dismantling poverty in Washington State, working closely with the Senn Fellow Lori Finks, who's been on the inside outside, so he's going to do a little inside outside magic. Dr. Nathan Chomolo he was the Medicaid Medical Director, a Senn Fellow from the great state of Minnesota. He is nestled and leading in and out of the Minnesota Department of Human Services. Nathan, always great. And then Justin Brown, who is the Secretary of Oklahoma Human Services Department and a big believer in hope. So the first question we're going to kick off, and I'm just going to go down the row and then we'll start mixing it up. But how do you define kind of lived experience and expertise? How do you engage with families? And just so share a little bit how you're doing that, and how has that changed literally how you lead and the culture of your agencies? And so actually, I'm going to go Amy, Nate, Justin, and then come back to you, Drayton, if I may.
Well, thank you, Anne, and good afternoon. I got it. Thank you. Sorry. It's good to be with you. So just a little bit about background on DECAL. We are not considered an HHS agency, although we're under the Administrative Children and Families at the federal level. We are Georgia's Birth to 5 early learning agency. So we focus a lot on child care licensing and quality rated and Georgia pre-K and, of course, our subsidy program. So for most of our creation as an agency, our focus was supporting child care providers and teachers. So we didn't directly deal with families, talk to families. It wasn't until about 6 years ago when we took on an opportunity to transition our subsidy program from our Department of Human Services to DECAL, because we see child care subsidy as truly part of that early learning system that we're trying to build in Georgia. And I know so many states are trying to do, and it wasn't a public assistance for us. It was really a scholarship for a child's early education. And so that's when we really started really engaging with families. And before we even transitioned that program, with all the administrative logistical things that go along with a program that large, if we serve about 50,000 children on an annual basis, we decided this was our opportunity to transform the program. And the way we transformed that is we started talking to parents and families all over our state. We traveled all over the state describing what we were about to do and asked them, how did we need to make it different and better for them? And what we heard was, we don't need you just to hand us a certificate, is what it was called at that point, but we need access to other services because we don't want to be on your program anymore. And so we heard that, and we took that opportunity to really transform the subsidy program in our state. We have a family support component now where our subsidy staff are fully trained in a family-centered coaching model. And so they use that model when they are supporting families with needs other than just paying for childcare. It may be helping them find childcare, accessing our resources to find quality childcare, understanding what that means, maybe early intervention services through another state agency, but other resources that they need to be successful, whether it's access to higher ed or workforce or housing or food, whatever it may be. And so we really took that opportunity to really transform the way we work with families. And that has really just continued through all of the programs at DECAL. That's really more of our culture now, where anytime we make a change to a program, we think about a policy, whether it's childcare licensing or quality rated. Our Georgia Pre-K program is that good for families? And so I really have to give credit to our transition of our subsidy program about 6 years ago to really changing the culture of the way we include family voice in the decisions that we make.
Yeah, good afternoon, everyone. Glad to be on the panel where everyone's cortisol is at its lowest point right now in the afternoon, so hopefully we can get that up a little. Nathan Chomel, I'm a pediatrician and internist and Medicaid medical director, as Ann said. And I came to work, a lot of my work had been focused prior to coming to Medicaid on early childhood and early childhood brain development in particular. And so lived experience was really the experience of families I saw in my clinic. But through kind of a series of life experiences, really start to reflect more on the structures and systems. And so as a biracial Black man, as a son of immigrants, I can't view any interaction or consideration of lived experience without talking about racism and structural racism in particular. And so that is what I came to Medicaid to do, was let's have a conversation about Medicaid's role in structural racism. Let's have a conversation about how can we have our policies more community co-created, community designed, and be more accountable to those communities that we serve that are disproportionately impacted by structural racism. And so we've put that into place a number of ways, but one I'll share is our work to build racial equity into the walls of Minnesota Medicaid. We looked at our data. We know that there's racial disparities in health outcomes in Minnesota. We looked at how Minnesotans get health care and what's Medicaid's role in that. And you can see that 40% of Black Minnesotans get their care through Medicaid. If you look at our children, it's 64% of Black Minnesota children that get their coverage through Medicaid. 39% of American Indian Minnesotans get their coverage through Medicaid, and that is roughly 59% of American Indian children, right? And so we can't really be addressing health equity, racial equity in childhood in Minnesota if Medicaid's not at the table. And so we began a process looking at not just Black Minnesotans, but US-born Black Minnesotans in particular face more health disparities. And so we started conversations with leaders about, here are the levers of Medicaid, and that's where my role as a state leader, I really think comes into play to be able to kind of do a better job translating what are the levers that states can work and different agencies can do. And so in Medicaid, that's eligibility, enrollment. How do you get your insurance card in the first place? Access. How do you access that care you need once you have the insurance card? Quality. Are you getting the same level of care and quality when you show up there? And then I really wanted to focus on what I call early opportunities, the fact that not only children are disproportionately covered, but our birthing persons, right? 8 out of 10 Black birthing persons, 9 out of 10 Native and Indigenous birthing persons in Minnesota are covered by Medicaid. So we have a unique opportunity to really help folks get on that trajectory towards success. And so presenting those levers, hearing where there's opportunities, getting that feedback from the community, and then going back to our policy staff, figuring out what are the policies that we can act on short-term, medium-term, long-term, and then coming back to the community and saying, here's where we see there's calls to action we can act on. Does this capture what you shared with us? And this is something that we can move forward together. And we put that all in a report that we published last February that laid out those was calls to action. Chief among them being the continuous eligibility for children under the age of 6. And so we didn't get that into the governor's budget last year, but we did this year as a result of that process. And it's in front of the legislature now to hopefully to go and follow states like Oregon where they've had continuous eligibility passed for children under the age of 6. And so we did this both to have some action, but also to model that this can be done. You can have a community-centered method of figuring out your priorities, and there's lots of ways to get to health equity, but how can we do it making sure that we're focused on what is the priority of the communities we serve?
Good afternoon, Justin Brown, Oklahoma Secretary of Human Services. Our agency in the state of Oklahoma is the largest agency. We have about 6,000 employees, serve almost a third of the state's population through programs that are familiar to many of you. Of course, the child welfare system, safety net programs, child support, child care, developmental disabilities, aging and adult protective services. The big work that we've been doing over the last 4 years is really centered around culture. I think that's one of the transformational opportunities that we have in human services. And the culture that we are working to build certainly evolves as we learn more, but it begins by being human-centered. And this concept of utilizing design thinking in the creation of the systems that we operate is critical. The second is outcome focused. So we're here to actually solve problems for families rather than solve problems for ourselves. The third is relationship focused, because we recognize that we serve a third of the state's population with 6,000 employees, and the math doesn't work. So we need relationships to do the work. And the fourth is trauma-informed and hope-centered. Of course, I'm a believer in the science of hope. So those are our sort of 4 elements of culture. When I think about how we embrace the voice of the community, the first thing that occurred to me as I took over the agency in 2019 was we operate programs that are intending to serve communities, but they were never informed by those communities. And so we're working to build internal structures that allow us to, of course, listen to the voice of parents and people who are engaged in the system. Our workforce has incredible perspective on the disparities that are perpetuated by our systems. But we're working to do that at scale. Well, again, 6,000 employees reaching all over the state of Oklahoma. The challenge is not in doing it, it is in scaling it and building it into the culture. So we've really embraced that first element is a human-centered culture. And so we've built design thinking tools. I refer to it as a design thinking continuum, where we've equipped the workforce to understand what design thinking is. It is the use of personas and journey maps on the front line. So you can think about if you're a front desk worker in Woodward, Oklahoma, what the experience is like for the person when they walk in the door. That just totally flips the culture in a huge system like the Department of Human Services. But then we go all the way up to full-scale vendor-led human-centered design when we're thinking about technology transformation or business process change. It requires us to be extremely intentional and do that work first before we then go into the technical components of developing technology or process change. So that's sort of the things that I think about when I think about sort of the voice of those with lived experience is not necessarily, although it is, building intentional structures for that, but it's how you scale it that's critically important.
Drayton Jackson from the Foundation for Homeless Poverty Management, and also Governor Jay Inslee's Poverty Reduction Work Group. And first, I got to start with giving a shout out to the steering committee, who I hope is on watching, because they are actually doing work today. Was supposed to be there, but here, and then also the staff at the foundation. One of the things that I think we did, and I was a part of, that I mean, is just amazing work, is exactly what everybody's talking here, and what the secretary said, getting everybody in the room and talking to each other. And Governor Jay Inslee, I think he saw that being an issue, and told all of his agency heads, get in the room with nonprofits, get in there and you guys work it out and come up with a 10-year plan for poverty. They did the work on their own, of course, as government and nonprofits sometimes do. And they came up with a report that, when we sat back as a steering committee and people with lived experience and said, this is a bunch of BS, and tried to figure out, well, who gave you this data? Where did you get it from? I never got anything in the mail that said, how's it going? And a lot of what we saw in there was just checking off the boxes and feeling good about themselves. And we sent it back and said, you got to do better. And as Ann said, Lori Finks, who the indoor-outdoor thing, I love it because it really shows what we were doing, is that Juanita and myself, who was picked as co-chairs, I was going into these big meetings in a big room with all of these leaders, and then coming out of that meeting and going back to the steering committee and saying, what do you think? Do we need to chop this up and make it harder? And we pushed them. We pushed every leader that was in our state to do better. And we gave them that this is our life right now. It's not our life later. So you need to fix it now because I'm going through it. And I think that resonated a lot with what you saw in the transformation. And this plan that we came up with is one of the first plans in government. We've heard this around, that was led not only by people with lived experience, but also guided by, as you say, giving them the keys. Oh, they gave us the keys. And we didn't really give it back. so the car is still out, right? But we're holding them accountable. It's like, if you want it back, let's get this in policy. And Governor Jay Inslee did something that was something that we asked, and it went right into it with opening the Office of Equity that's led by Dr. Jay. And that Office of Equity made them look at every agency, which we asked. Are you equitable in what you're doing in your services? And that has led to a lot of change that has happened. And what that did for me was allow me to now, as almost 2 decades of homelessness, go back in and start my own foundation to do that work. And what I saw in that room with the Poverty Reduction Work Group was all the leaders in the room talking. And it's just what the commissioner said, is that there's so many policies that doesn't allow them to talk. So when I started my foundation, the first thing I said is I want a building where I can allow them to come in and just have those conversations. Not saying, hey, we're just gonna do a one-stop shop, but really knowing that I need you in this building because when you talk to them, we can get somebody services quicker, and we have done that at the foundation. So a lot of the work that we have done was seeing that communication, but the trust. It took us so long to get trust with them because we didn't believe that they would use what we said. Somebody said it earlier on the panel was that, they listened to us, but they're going to take what we said and put it into action. And I can seriously say that all of the agencies, Bab Roberts from TANF and all of the other agencies that was there, did that work. And all you see in that 10-year plan is what we said we suggest, and we're doing the work.
Dwayne, I'm going to dig back on that a little bit more because this work in Washington State was literally a 10-year commitment and ongoing, and to dismantle poverty and also change how we go about thinking, doing this work. And so you have leaders here of government agencies, nonprofits, foundations. What should they know if, what advice and expertise do you have? Like, these are 3 steps to build the trust or to really pragmatically and with purpose do this for real.
Deal with your community partners. I'm saying that because I'm watching it myself as people walk through our door. The Statewide Poverty Action Network they got the grant to be the liaison between us and them. And Marcy Burroughs and Lori Pickford had a great relationship. And what I watched in that dynamic was we sat in a room with an organization that the community trusted. They spoke our language. And then she was able to take that and work with Lori to say, this is what they're saying, and this is what it has to be done. And they were able to create something that speaks to policy and blah, 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 law, blah, 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 other things, right? So when we really had to say this is that the Attorney General, Bob Ferguson, kind of alluded to that, most of our policies are written by us as lawyers. So you're not gonna understand it. So think about that. So if these things and these applications are to protect the state and whatever it is, it's not there to protect me. So you have to have that trusted agency that the community really trusts. And let me tell you how I know that this is real. We have DHSH in our building. Shout out to Babs Roberts, who was just like, let's get to work, let's do it. So we have them in our building where a homeless person feels safe coming in because they know my story. They know that this building is there for them. But what I also found is that a lot of our indigenous people did not have a place to go that they felt. They don't want to walk into the white man's government office that took it from them. So when they started to see that we were there, we started to see them come in. And it made me, if there's a light that went off my head, it's like, oh my goodness, it's about making that acceptance place that, hey, you feel belong no matter what. And that belonging is like, we're one of the first states that's stepping out to say that we want to be a belonging state in everywhere. So you have to have that trusted agency. The second thing is open up and listen. As my colleague said earlier, you have to listen to us earnestly. Not in the passion of you don't know what you're talking about because you don't have the degrees, which I've heard somebody say to me one time, is my lived experience. I have a PhD in pain. There's no question about it. All right, I have a bachelor's in understanding that the trauma that I go through in the services is real. So those are the things that I come to the table with, and all of us come to the table with. The steering committee, every one of us was committed to making that change. The third thing that I say is making sure that you put into action what the hell we say to do. We're not saying it because, oh, we just want to complain. We're saying it because we know the barriers. And I'll start with what Babs Roberts did is she never thought about the 2-generational approach of walking into a DSHS office and how it is not kid-friendly. And when she said, man, that she went right to work and started just a little library, changes it, just a little bit of this. So those are the things that we need. But you also, to caveat just one more thing, you have to be bold and ready to risk your job to get that. Because I'm telling you that those leaders that we had in Washington State, David Stillman and Tim and all of these, they were bold. And they said, no matter what, I'm going to help change their life.
And the governor looks very good right now. Hey, you want to jump in? And Governor Inslee, I say it with all respect.
Yeah, I really wanted to add on to that and some experiences from building our report, like right along with that, about having the trust piece is real, and it starts with who is leading your effort. And we were able to look at the data and focus on U.S. born Black Minnesotans, but I think some of it was because I'm in the community, and there's people that came to the table who had told previous people in my position or previous people at the state the same things before, and so they didn't have a lot of faith that things were going to change. But I said, this is going to be different this time, and so part of that was and continues to be going back and sharing how you're doing along the way. We came back in the spring after the report was out and shared the report and continued to have those conversations. We brought the lieutenant governor and our commissioner in to meet with the leaders so they could hear directly what piece of the report they wanted to be pulled out. And then being able to, that actually, you talk about your PhD in pain, you got paid people for that experience that they're bringing, right? And that's something that we're working on, is trying to figure out how we build that in our budgets, that this type of engagement is something where everyone in the room is, their time is valued the same, and we're paying and we're figuring out other resources, because when you talk, we want to come and hear about things in Medicaid, but human services is pretty broad, and Medicaid is one part of people's lives, and they'll bring up other things that they need in those spaces. And so are you prepared to kind of meet that as well? And so I think, making sure people in your organization, you value the lived experiences from a number of different perspectives that you are reporting back, and then that you are willing to pay people the same.
Okay, that is so awesome. So one thing, building that into your budget, and then there is legislation that has been passed and being implemented in Washington State that codifies this as the way to do best governance. So more to come.
Yeah, I sent
So,
that to you.
I was like, and so, Amy, I would love for you. I mean, 2Gen has really kind of transformed how you're sort of working at DeKalb, thinking not just about the kids, but like children and the adults in their lives and their parents. And if you could share one or two of the 2Gen policy innovations you've done recently.
Sure. So again, when we decided to transform our subsidy system, we wanted to be the best subsidy system in the nation. And that means for families no longer to need us, to improve their economic mobility and their family well-being. And the one specific way we began was to partner with our Technical College System of Georgia, which is our community system, our community college system. Because in Georgia, our TCSG is very accessible, it's very affordable, it's free in most cases because of our HOPE grant funded by Georgia Lottery. And there's a 98% job placement rate. But they serve non-traditional students. 1 in 4 of them are student parents. And one of the main barriers to completing that degree is access to childcare. And so it just made perfect sense to build a partnership with our technical college system because their students need our childcare subsidy, and our families might want to go to TCSG because that might be their path toward economic mobility. And so we began this partnership with TCSG several years ago, building a relationship with our staff and our teams, building awareness of the issues and how we can help each other for our families to be successful together. We shared resources, we shared training, and because of all that and the learning from these past few years, we've changed our policy in our subsidy program. Originally, we only allowed for a parent to get a credential or a diploma. And that's just the way it always was, right? And just through our learning, we've very gradually and strategically changed our policy. We now, of course, allow an associate's degree. We now allow a bachelor's degree to be an accessible activity, an improved activity. But most recently, and what I'm really proud of, and the numbers are pretty amazing, we do fund with a priority group methodology for our subsidy program because we have a finite amount of money, and we use an equitable approach through our priority groups. We have 13 priority groups. So in addition to the income requirement, the activity requirement that all subsidy programs have, we have 13 priority groups, meaning we're trying to serve those that need it the most. So, for example, a family that's experienced domestic violence, or they have a child with a disability, or they're in foster care, and we just added a student parent priority group. And that was, we were a little hesitant because we had a finite amount of money because we just didn't know what the demand was. The demand is there. Over 17% of our applications are for student parents. And so I'm excited that they are taking advantage of it. Our Technical College System of Georgia is very excited, and they share this opportunity with student parents. And I hope that we can start tracking their success and their results. And I'm really excited about that. I've been wanting to do that for years, and I'm glad we were able to finally make that happen. And then secondly, really at the state level, I'm also the co-chair of the Georgia Children's Cabinet, and that's all state agencies that deal with children. So behavioral health, Medicaid, child welfare, Department of Education, and we also have community partners, nonprofits, advocacy groups that are part of the Children's Cabinet. And because I have an audience of a children's cabinet and I can kind of, show them my priorities, which is 2Gen, we created a 2Gen Leadership Academy. It's a 9-month leadership program where middle managers from state agencies go through a very rigorous leadership academy with day-long learning sessions. Built in conjunction with our university system, we worked very, very closely with the team here in Ascend to really build a really incredible leadership academy to learn what 2Gen is, learn how to build relationships within your community at the state level. And we will have our first graduating class in June where they will end with capstone projects. And so we hope we'll even learn more about how we incorporate our other state agencies. Because again, I'm the decal, I'm the OCC, I'm not the HHS. I just have the CCF dollars. I don't have the TANF and the Medicaid and the SNAP and the WIC. We want those folks on board with our 2Gen strategy in Georgia. And so that's one way that I hope to accomplish that in Georgia.
So awesome. So Justin, I'm going to add on for you. So as you think about, we talked about being inside, outside. You have not been sort of public sector. This is, you jumped in with total passion and you did a lot of disrupting. And I'm going to channel Randall from the earlier session where he asked one of the most behaviorally challenging questions for leaders in terms of also what do you stop doing when something is not working for those it's intended to serve. And so from your standpoint, just love to hear what have been the most meaningful, significant shifts. And if you can name in those shifts maybe what stopped happening or you stopped funding or did differently.
Okay, so I will work my way to that other piece, right? So ultimately, when I shared the culture that we're trying to build, the second piece was outcomes driven. And so to me, if we have programs that aren't achieving outcomes, first we should stop those. But second, when we are focused on outcomes, we should never begin programs that aren't expected to achieve those outcomes. Right. So that's really from a cultural perspective, we're trying to shift the agency. One of the really, you've mentioned inside out. And so, yeah, I came from the private sector. I was in the senior living space for 11 years before I took over the agency in 2019. And when we talk about disruption, of course, I had, while we, of course, would never wish for a pandemic, I had a really wonderful disruption to follow, right? Like, so we had our mission built and we were ready with outcomes and we started changing things as we could. One of the things that has been really impactful, and I think will sort of extend beyond I hope will extend beyond my time, is the rebuilding of the distribution model for human services. That is the biggest opportunity we have, is to build a model that is much more proximate to the people that we serve. And so we have actually closed 41 of our offices. Out of 41 of our 92 buildings, we've eliminated about 1 million square feet. But when we leave an office, we don't leave a community, we actually go deeper into the community. So our new distribution model really has 3 components. It's people, places, and technology. And the people is mostly centered around our embedded worker strategy. So I heard Drayton talk a little bit earlier about Bab's team being in your office. We have hundreds of embedded workers from the Department of Human Services embedded in places like homeless shelters, in schools, in law enforcement offices, in hospitals, with the intent of meeting people where they are. And I realize I need to start weaving in that meet people where they dream. And so I'm excited about that. That was something I took from here. But unfortunately, we're government, so we're still back meeting you where you are. So we haven't yet evolved to that next model. But the idea is a proximate delivery model where we move from transactions to relationships, because our systems are so built on this definition of success being quality control rates and timeliness to benefits delivery. And yes, efficient, effective government is important. However, it's not the definition of success for the people we serve. The definition of success centers around upward mobility and reduced reliance on systems and being able to support your family and living with purpose and those sorts of things. And there is nowhere where we really measure those sorts of things. So that outcomes-driven approach allows for us to invest in projects like a rebuilt distribution model where we're going to make lots of mistakes. This is a massive change. But it also does allow for us to say, and have a reasonable filter to say that, yeah, this thing's working, but this one over here isn't. Let's redirect dollars because we're not achieving outcomes for families.
And Nate, I'm really curious about what advice or insights or models you want to share, but where you named in your leadership work has been grounded in, as you said, racial equity and Medicaid. And Medicaid is one of those policies, it's so important and it's so misunderstood. And then we have health and well-being, and it's also a huge economy, business. And so for those in the world who want to or will, they just don't know it yet, want to be part of building anti-racist, culturally competent, loving, effective health and well-being, so every child is born healthy and greeted with their family, stable home, all that stuff. What advice for those people who are talking about wanting to do it and doing it, that to do that well, anti-racist health and human services?
I mean, you think you've heard a lot of it from my co-panelists. It starts with knowing your community. And, Medicaid, the kind of standing joke I'm sure folks have heard is, one Medicaid agency, you've heard no one Medicaid agency. It's somewhat how it's designed, right? A state-federal partnership. And so you need to know what's going on in your states and what's going on in your community to figure out how to make those connections. And, one of the models that started actually before I came to Minnesota Medicaid was the integrated care for high-risk pregnancies, which were at the beginning of Black Maternal Health Week. So happy to talk about this model in particular, because it really has been from the ground up been community co-created, focusing on African American and American Indian communities who, realizing disparities existed there, figuring out if we just had grant money that was then completely, dictated by the communities most impacted, we're able to set up advisory councils, come up with a overall theory of change and a model of care that is been designed to meet folks where they're at. And so government is trying to, I think, meet folks where they're at. We're not quite even there yet. And so this has been built up over the last 6 years. And we have a successful collaborative now for African Americans, Healthy Black Pregnancies. That is delivering care, and not only just the care in the clinic, but doing modeling and centering models where they're connecting mothers to other mothers and other birthing persons. We have a doula dads program to try to loop in dads. There's early childhood brain development, PSAs, and ways to get information just about healthy parenting, positive parenting. And so really trying to find ways that government can help support what has already been done. And a lot of the stuff was already been done. It just needed the ability to kind of start scaling it up, to your point. And we have since launched a similar collaborative with American Indian communities in Bemidji, Minnesota, and in the Twin Cities as well recently with Mwinza and Midwest Indian Resource Center. And so really, how do you have that both flexible funding and flexible policies, right? How are you able to kind of look and say, and push back against that? We've always done it this way. We've always had to report on this. These are the statistics we look. And how do you give that control over to communities to say, this is how success is defined. This is how we are going to say, the funding you are allowing us to recapture benefits us, and make that case. And doing that, we've been able to increase funding, and our goal is to kind of scale it so all mothers and birthing persons who identify as Black, American Indian, Minnesota can have access to it, not just those on Medicaid.
Okay, amazing. And I love that what does it mean to give up control? Talk about power. And so I don't have control or power to go much longer over here, Marjorie Sims. So just keeping me like good with my friend Marjorie here. If we could maybe go Justin, Amy, Nate, then Drayden. Like your concise but compelling call to action or your greatest dream when you think about intergenerational family prosperity and the place from where you sit.
In a minute and 30 seconds, my greatest dream.
60 seconds.
I'm sorry, 60 seconds. So what immediately comes to mind for me is immediate access to the best resources. I wasn't super prepared for that question, but as you were asking, it was, we have a community or an individual or a family that needs something, that they have it. That's the goal. And honestly, we're a long ways from that. And I think I'm preaching to the choir here. But I think it does start with rebuilding that culture towards being centered in the person and the community that we're trying to serve, and then creating outcomes that are really focused on serving them. And I think a short-term dream for me would be something that I'm here frequently talking about, is the creation of a national outcomes committee for the SNAP program. Because I see lots of government shooting dollars and programs out to the community, but it doesn't have a lot of direction to it. And I think if we could come together and create a common definition of success in these programs, then it's true. I think it was Assistant Secretary Contreras said that we have 50 laboratories across our country that can navigate their own personalities and their own needs, but we're shooting at the same thing that we all agreed towards. And so that's a long-term and a short-term dream state.
So two dreams. One is to change the culture of state government in Georgia so that we're all using a 2-gen approach daily. Don't even have to think about it. It's just part of what we do. I'm trying really hard, but I only control the subsidy policy. But I'm really trying with some other pulpits that I have access to. And then second, and my staff that are here are probably going to laugh, but my goal for them is to have the best subsidy system in the nation. And that means you no longer need us as a family, because we're providing support to you that you need, that you decide you want, to make you successful as a family. And so I think using this 2-gen approach, and specifically right now with our focus on working with student parents to have access to childcare, finish that degree, and become economically successful, is one step towards that dream.
Yeah, I think I often reflect on a lot of the programs I see out there, and the efforts that are, I think, well-intentioned, but are they actually helping folks dismantle systems of oppression and systemic racism, or are they just helping people navigate them, right? And how much money I see spent on just helping people navigate a broken system that could be spent on actually challenging that system. And so I think my dream is that we, figure out what needs to change. And I think a lot of it is the incentives. We haven't talked too much politics here, but there's political determinants of health, right? And so what in the systems need to be changed so that the incentives are rewarding folks who listen to community. They're rewarding folks who are community-led and co-creating. And I think that system will get us to where we say our shared goals are, but we continue to kind of miss the mark.
So I'm gonna give something and this is gonna be good. So I'm gonna shout out one thing: Community Advisory Board for the Health Policy Center at the Urban Institute, right? It's funded by the Robert Johnson Foundation in collaboration with Community Catalyst. Reason why I bring this up is because it's the first time that researchers from Urban Institute was in a room with people with lived experience. And it blew their mind because they had to give us their research and we deciphered it. And we were saying, what are you doing? What questions? Why are you asking that question? That has nothing to do with what we're really going through. And to the earlier committee, that's what it's about. That's what it's about. And I'm happy that Ascend was even focusing on the research part of it, because when I saw the faces of a lot of the researchers and said, you guys have blown us up, like I would have never thought about asking that question. Of course, you're not going through it. Then the second part I'll bring is, me as an executive director of our foundation, we started buying property and we started doing the work. But I've messed a lot of people's heads up, and even the consultants that come in because we don't say we build affordable housing, we build housing that's affordable. So what we did is we started to have the panel with lived experience, and I'm sitting across from a guy I'm paying a lot of money to counsel us on how to build this housing. And he's being struck by all of these people that have lived in projects and housing for all their time, and consulting him. So my goal would be that no matter what, your board, your committee, every aspect, that you have people with lived experience there. And as you get out of it, which I'm hoping to get out of my experience of it, that I open the door for the next person to come through with that lived experience and show them how to sit and be in that space. I sit as an elected official on my school board, and I say this. I sit as somebody coming through poverty and homelessness. So many of the children that I affected being on the board that I did not know that I affected, because I was able to tell my story, affected how our school district in Central Kitsap runs. So you want to talk about equity, we see it because I'm the only Black on my school board, but the lens I come with goes deeper than that: poverty, homelessness. So our McKinney-Vento children, I've had a lot of those parents and children come up to me and said, man, I didn't know I can be there being in poverty. So making sure that we're at that table and really listening to us.
Amen. Please join me in thanking Justin, Nate, Drayton, and Amy, and your leadership in Oklahoma, Minnesota, Washington State, and Georgia are examples for all of us and all the people and families that you work with. Thank you
Thank you.
so much.